So this is just a fishbone regarding the fall-related injuries. So there are different factors that go into it. I kind of went over the root cause of it, but now we're gonna kind of dive in a little bit deeper. So there's environmental factors, which was the leading one, such as wet floors, patient tripping on blankets, cold rooms, and the lack of patient visibility from the nurse's station. So those are more the environmental factors that have influence or have their play, I guess, in fall-related injuries. Another one is actual fall risk assessment. This is the inconsistency that occurs within nursing in our assessment of fall risk. Another one that also plays into this category is high-risk fall patients that aren't identified. So sometimes, we do get busy. I know this. I work in emergency, and we do get busy, but we can't foresee those patients, and because then you're essentially putting them at risk. We're not identifying them when we should be identifying them as a fall risk. Another category is patient factors. It's sad to say it, but yes, they do play a factor into this. This can be of medications, either that they're already taking or that we are giving them. Sometimes, some of the medications we give, they make you drowsy. So it could be stuff like that. It can be medications that they're already taking at home, such as Lasix, that they need to essentially go pee every 5 minutes, and they're getting up and just having to go. It can be those kind of medications. Any gait and imbalance, that could also attribute to falls. Any confusion, memory deficits, because then when you go to educate the patient, like, hey, you need to notify me when you get up. If a patient has any type of confusion, they're not going to fully grasp the concept of you telling them the education that they need to know, And also, like I said, incontinence. If they cannot hold their bladder to go enough for you to come, unhook them, and everything else, they're essentially just going to run to the restroom. They're going to run to the restroom as fast as they can because they cannot hold it. Also, staff communications. This also played a part as well. So there is lack of communication regarding fall risk and intervention. Some people probably do take this, very serious, where other nurses probably, yeah, they're fine. They kind of make it smaller than what it is. So that's also a type of, it falls in this category. Another one is also our rapid response team is not called post-fall. So this is important. This is so important because after every falls, we just learned about this. 1 in every 5, I believe. 1 in every 5 are gonna have some type of head injury or some type of fractured bones. This is essential to have a rapid response team notified after, to have either CT, some type of intervention to show and know that, yes, the patient fell, okay, but we need to make sure our patients are safe. And these all end up relating to injuries. And this is just key little ones that I found that I thought that they were really interesting and really cool to bring up because they all attribute to fall-related injuries.